Hi, I'm Evelyn Hicks, Director of Clinical Education for Pulse Medical, distributors of Endoform and Hydrofera Blue. Today I have the distinct pleasure of speaking with Karen Edwards. Karen, thank you for joining us.
Thank you so much for the asking.
I understand that you use the entire Hydrofera Blue family. When were you first introduced to Hydrofera in your practice?
So back when I was in home care, I was introduced to Hydrofera Blue as a new product. I was very impressed, and it's the classic. And that was the original piece. And so we had different ways that we could use that. I thought it was a smart dressing. You could use it so many different ways. So like, for instance, if you had a wound that was dry, when you hydrated the Hydrofera Blue and you would leave some of the moisture in it and it would give moisture. If you had a wound that was wet, you squeeze out the excess saline when you hydrate it and put it in there, and it absorbs moisture. It also would tell you when it's done. It's killed as much bacteria as it can because it would turn white. Because it absorbs the bacteria into the foam and kills it in the foam. So therefore, when you take that dressing off and throw it away, the bacteria is gone.
Excellent. Now, in the home care arena, I know you've transitioned now to the acute care. Talk about how Hydrofera Blue Classics worked in your practice there.
Well, when I came from home care to UAB Hospital, and it's 1,100 bed facility, and you know, they had a whole bunch of different wound care products, but I brought my favorite with me from home care transition into the hospital. So again, it still had the same properties as used in home care. Now we had to, you know, educate the nurses on how to use it properly, but it still had the same properties.
So I know you've used Hydrofera Blue both inpatient and outpatient, and you say it's very versatile. Give us some examples of that versatility and what that means to you.
Well, one of the great things is it's non-cytotoxic. So you can use it on all ages. And you don't have to worry about anything being leached into the wound bed. You don't have to worry about any kind of chemicals being dispersed into the wound bed. So that is one of the major things to use on patients in a hospital or anywhere.
Recognizing that you have sharp debridement properties because of your designations, how does Hydrofera Blue help you when you're working with your patients who need that type of service?
Well, I can do excisional conservative debridement. So not a surgeon, but what I do with some of the wound beds are shallow. You can't tell how deep it's going to be. So you don't want to be cutting into something that you have no idea. So with that, then we use the Hydrofera Blue to aid in autolytic debridement because it helps soften the necrotic tissue and helps the body expel it itself.
Hydrofera Blue Classic has the ability to aid in epivoly, and you have two different ways that you use it. Explain that to us.
Well, manufacturer recommendations are to overlap the wound edges like 1 centimeter, 1 or 2 centimeters to help flatten. And let me just say that epivoly, I didn't know that word for quite some time. How crazy is that? But that is the medical term for rolled wound edges.
Correct.
So they're very hard and used to, the only thing that you could treat it with was silver nitrate, or you had to surgically remove the edge. But with Hydrofera Blue Classic, if you overlap the wound edges, it will actually flatten out the epivoly. And then also, I use it in my practice. I cut it exactly the size of the wound, so it's actually touching the rim on the inside of the wound.
And what results are you seeing with that?
It's pulling the edges together and opening them up. So
Excellent.
Either way, it works either way.
Great. Given that you have access to Hydrofera Blue Classic on the inpatient side, what are some other ways you have taught your nurses to utilize it?
Well, some patients have wounds that are not applicable for negative pressure therapy. So we actually have used Hydrofera Blue as what we call a mini vac, so that it does have some natural negative pressure qualities and pulls in fluid from the tissues. And so we have seen that work very well on healthy wounds. So again, you can use Hydrofera Blue Classic from start to finish. It'll help debride it. It helps maintain the moisture barrier, moisture level. It also aids in pulling the edges together. And so you can use it from start to finish. You don't have to change up as much.
Excellent. In Canada, we have claims with Hydrofera Blue Classic that it disrupts biofilm. What have you seen here in your practice in the States?
So with biofilms, they're tricky. They talk to each other. It's kind of like they're having a little campfire and have a dome over them and nobody can get in there. So what the products do, Hydrofera Blue Classic If you put that on the biofilm, then it starts to disrupt the membrane of the biofilm. Now, the bacteria are smart, so they'll start talking to each other and say, hunker down, they're trying to kill us, and they'll hold hands and be in a little circle. So then what I have done in my practice is that I rotate my products. So I'll use Hydrofera Blue Classic, and then I might change to a silver to disrupt, and then I'll switch back to Hydrofera Blue. So every 2 weeks, if you change up your products, then it just helps with disruption of the cell membrane because they can't get together and protect themselves.
Excellent. Now, when you're teaching your clinicians who are new to wound care about Hydrofera Blue Classic, walk us through the steps on how you would place that into the wound bed and when you decide to use Classic and what are some of your parameters?
If I have a wound that more so needs moisture, also with autolytic debridement, then teaching them how to hydrate it properly has its challenges, but the Classic works the best of all the Hydrofera Blue line as far as epibly, autolytic debridement, absorption, and giving back moisture. So it is the smartest of the family of Hydrofera Blue. We also have the other products in our arsenal.
Yes.
So we have Transfer. We have the Hydrofera Blue tunneling, and it's Classic. So those are the main ones that we use, and we rotate, and it just depends on the wound, which one we choose to use.
Understood. Now, obviously with Classic, there's a cover dressing that you have to select. Walk us through the process in which you would choose your cover dressing for Hydrofera Blue Classic.
If I have a wound that is relatively dry and doesn't have a whole lot of drainage, then I would probably use like a thin film. Now, if I have a wound that's draining a lot, then I will use a silicone bordered foam so it can absorb the excess and not be as traumatic on removal.
Excellent. You've alluded to how Hydrofera has lots of unique properties and applications. Give us some examples of some things that are your go-to with Hydrofera Blue Classic.
I have found that, and whether it's anecdotal or whether you have research about it, I have discovered that Hydrofera Blue is a pain reducer. So in my clinical experience of 20 years, that is my go-to for people with pyoderma. So we have pyoderma on the legs, everything's so painful you can't touch it. So you can place Hydrofera Blue and leave it for several days, and it actually helps with the pain level.
Karen, given you're in the acute care setting, do you have any best practices you'd like to share with how to manage Hydrofera Blue Classic?
Well, the original manufacturer's recommendation was to lift it after 24 hours to see if there was any white, because that means that it's absorbed the bacteria into the dressing and it's killed it. So if it's white, it's lost its fight. But our problem is in acute care, in a 1,100 bed facility, even if you write the order, A, they don't read their order, but B, it's like nobody's going to look at it in 24 hours. So as our protocol, we just recommend changing it every other day and just blanket it, because we know that everybody's busy, and our job is to basically, in acute care, to clean them up, to send them back out.
Excellent. And what about removal? Any best practices with regards to that?
Well, my thing is, it's like if it's dried out, if it's managed its moisture, or it has absorbed into the wound bed because it needed moisture. So now we have what I call blue scabs. So you've got this little dried up piece of Hydrofera Blue, and if you pulled it off, you're going to pull off skin because it's adhered, because it sucked out every piece of moisture. So we just rehydrate it, let it sit a minute, and then we remove the dressing. So you're not causing any trauma to the wound bed.
Excellent. And when it comes going back to autolytic debridement, are there other types of products that you use in conjunction with Hydrofera Blue Classic?
Yes, so we can use Santal, which is the only FDA-approved enzymatic debrider, and it's compatible with Hydrofera Blue. So if you want to get a double whammy, so to speak, then we would use the enzymatic debrider as well as and cover it with the Hydrofera Blue.
So I know at UAB, you've had some great outcomes with regards to cost savings. Can you just walk us through what that means to you and how Hydrofera Blue Classic works into that regimen?
Well, we are part of the supply chain. So any kind of product that comes into the hospital, wound related, they come to us, which is nice that they just don't pick and choose what we use as clinicians. They actually respect our knowledge. Yay. So anyway, we have reviewed many different products. And Hydrofera Blue is very cost effective, and because you can leave it on longer. Some that you have to change twice a day or every other day or daily. So we have, the supply chain has no problem with Hydrofera Blue at all.
Excellent. Well, thank you so much for sharing all of your pearls of wisdom when it comes to Hydrofera Blue Classic. I'm Evelyn Hicks, Director of Clinical Education with The Pulse. For more information about Hydrofera Blue and the family of products, please visit www.hydrofera.com. Thank you.
Thank you.